What if I told you that the medications everyone knows for weight loss are actually doing something far more powerful inside your body? Something that could protect you from heart attacks, defend your brain against Alzheimer's disease, and reduce inflammation linked to virtually every chronic disease. And what if some people are now taking smaller doses, we call it microdosing, just for these hidden benefits? I'm Dr. Zaid Fadul from Bespoke Concierge MD, and I've spent the last few weeks diving deep into the GLP-1 research as a physician interested in longevity medicine. I need to tell you something. The science is real, the excitement is justified, but the certainty, that's where it gets interesting. By the end of this video, you'll understand what these medications actually do, whether microdosing for wellness has evidence behind it, and most importantly, what this means for you. Here's what's dangerous. Everyone thinks GLP-1s are just for weight loss. So when inflammation markers start dropping within 3 weeks, most people don't realize it's even happening. They don't measure it. They don't celebrate it. They just keep taking the medication for the wrong reason. Most of you have heard about GLP-1 medications like Ozempic, Wegovy, and Mounjaro in connection with weight loss. And yes, they work for that. People are losing significant weight all around the country. But here's what gets overlooked. These medications are doing something simultaneously remarkable. They're fighting inflammation throughout your entire body. Think about inflammation for a second. It's not just the redness you see after a cut. Chronic, low-grade inflammation is the root of most modern diseases. Heart disease, type 2 diabetes, Alzheimer's, arthritis, even certain cancers. You can check out my video of the impacts of chronic inflammation here. Chronic inflammation is like a fire burning slowly inside your body, and most people don't even know it's happening until something goes really wrong. GLP-1s appear to be one of the most powerful tools we have for turning down that fire. But, and this is important, almost all the evidence for these benefits comes from studies using full therapeutic doses in people with diagnosed disease. So when some people are now asking, can I take a smaller dose for general wellness? That's where things get murky. That's the conversation I want to have with you today, because you deserve to understand both the promise and the limitations. Let me start with the data that genuinely excites me as a physician. In the landmark SELECT trial involving nearly 18,000 people with heart disease but no diabetes, researchers wanted to see what happened when they gave semaglutide to people who weren't obese, just regular people with cardiovascular risk factors. And here's what they found. Within just 3 weeks, inflammation markers started dropping. By 4 weeks, CRP, the main inflammation marker we use, had fallen about 12%. By 8 weeks, it was down 20%. But get this, these early reductions weren't stopping. After 2 years, patients on semaglutide experienced a 38% overall reduction in their inflammation levels. And here's a part that genuinely changed my thinking. Most of this happened even though people were losing very little weight in those early weeks. Some patients who lost less than 2% of their body weight still saw significant inflammation drops. This tells us something profound. The anti-inflammatory effect isn't primarily working through weight loss. Yes, fat cells do produce pro-inflammatory molecules called cytokines and adipokines, so losing weight helps with inflammation. But patients who aren't losing significant weight are also showing real benefits. It's working through direct mechanisms. The medication is literally changing how your cells produce inflammatory chemicals. How? These medications block something called NF-kappa beta, which is basically the master switch that controls inflammation throughout your body. They also activate pathways that calm inflammation and reduce oxidative stress, the cellular damage that drives aging. Think of it as turning down the volume on your body's overactive alarm system, the one that, over decades, leads to disease. So what else is happening when people take these medications? First is cardiovascular protection. This one shocked me. In the SELECT trial, semaglutide reduced heart attacks, strokes, and cardiovascular death by 20% in people who weren't even trying to lose weight. A 2025 study from University College London confirmed that protection happens regardless of how much weight people lose. Even older GLP-1 medications that cause minimal weight loss still significantly reduce cardiac events. This wasn't supposed to happen. Patients weren't losing weight, but their hearts were getting protected. That fundamentally changes how we think about these medications. 2 is brain defense against Alzheimer's. This is where it gets genuinely exciting for me as someone interested in longevity medicine. In an analysis of 1.7 million patients with diabetes, semaglutide was associated with a 46% lower risk of Alzheimer's disease compared to insulin, 33% lower than metformin. Let me say that again, 46% lower risk. That's not a marginal benefit. In a clinical trial called ELAD, the GLP-1 medication liraglutide slowed cognitive decline by 18% and actually cut brain shrinkage nearly in half in the regions that control memory and learning. Imagine knowing you could reduce your Alzheimer's risk by nearly half. Not maybe, not potentially, based on data from 1.7 million patients. We're talking about potentially reversing cognitive decline, not just slowing it. 3, liver and kidney protection. For patients with fatty liver disease, GLP-1s reduce liver fat, improve liver enzymes, and may slow scarring. For kidney function, they slow kidney damage, reduce protein loss in urine, which is an early warning sign of kidney problems, and they lower progression to kidney failure. Here's what's remarkable. Over 50% of kidney protective effects can't be explained by changes in blood sugar or blood pressure alone. That means direct cellular protection we're still discovering and understanding. Early research suggests GLP-1s might reduce risk of certain obesity-related cancers. Obviously, this needs more research, but the mechanisms are plausible. They reduce the inflammation environment where cancers grow, lower insulin levels that feed cancer cells, and enhance immune response. So all that sounds amazing. You're probably thinking, Dr. Fadul, where do I sign up? And here's where I need to be really clear with you as a physician. We don't actually know if microdosing even works. Microdosing means taking doses lower than the FDA-approved starting dose of 0.25 milligrams weekly. We're talking 0.05 to 0.125 milligrams. Some people use click counting on pens to dispense smaller amounts. People are drawn to this for a couple good reasons. Reducing side effects like nausea, lowering costs by stretching medications longer, trying to get wellness benefits without needing maximum doses. All of which sounds reasonable, so what's the problem? Everything I just told you, the heart protection, brain protection, anti-inflammatory effects, comes from studies using therapeutic doses, not microdoses. The FDA has zero guidelines on microdosing. There are no phase 2 or phase 3 trials current. We're not working from proven science here. We're working from educated guesses based on how we think the medication should work at lower doses. Do you get the same anti-inflammatory benefits at 0.125 milligrams that you get at the full 2.4 milligrams? Maybe. Does it protect your brain? Theoretically, but we haven't proven it yet. That's the honest challenge. Much like Deadpool, many providers are making an educated wish. But here's what is happening right now. The first clinical trial specifically studying microdose GLP-1s for health and longevity just started in December 2024. That trial, effectiveness of microdose GLP-1 in improving health, quality, life, and longevity, could change everything. Or could prove these lower doses don't work meaningfully. Either way, we'll finally have some answers. As a physician interested in longevity medicine, I'm watching this closely. But until results come out, which could be years, we don't have definitive evidence. If you and your doctor decide to try GLP-1 therapy, whether at therapeutic or lower doses, how do you actually know if it's working, especially if weight loss isn't your main goal? This is the practical question my patients ask me, and it's fair. In my practice at Bespoke Concierge MD, we regularly test inflammatory markers. The most direct measure is high sensitivity C-reactive protein, or hsCRP. It typically falls on GLP-1s, and you can track it over time. If your inflammation is dropping, you're likely experiencing less achiness, fewer skin issues, and importantly, your disease risk is decreasing. I also monitor metabolic health, specifically fasting blood glucose and hemoglobin A1C, which is your 3-month average of blood sugar. Better glucose control reduces inflammation and disease risk. It's important to track your cardiovascular markers like blood pressure, cholesterol levels, and kidney function tests. These tell you if the medication is protecting your heart and your kidneys. The other indicators are your experience. My patients often notice less mental food noise and fewer cravings, more stable energy without crashes, better sleep, and finally, improved mental clarity. But, and this is important, these subjective changes aren't a substitute for objective biomarkers. You need both, how you feel and what the labs show. So all this leads to one question you're probably asking yourself right now. Should I be microdosing GLP-1s for my health? Let me be direct. I can't tell you whether you should take this. Your doctor can. But I can walk you through exactly who I'm recommending this to in my practice, and more importantly, who I'm telling not yet. Here's how I think about this systematically. There are 5 groups of patients where I actually feel confident discussing GLP-1 therapy for wellness purposes. First, people with prediabetes, insulin resistance, or metabolic syndrome with elevated inflammatory markers. If your fasting glucose is 100 to 125 and you have a family history of diabetes, you're not diabetic yet, but you're close. This is where early intervention really matters. Second, women with PCOS or hormonal metabolic dysfunction, especially in perimenopause or menopause. This is one of the few interventions that addresses hormonal and metabolic functions simultaneously. Third, anyone with a normal BMI but high body fat percentage, what we call metabolically obese, normal weight with documented metabolic dysfunction. Fourth, people with a family history of early cardiovascular disease and personal risk factors like high blood pressure, elevated cholesterol. And fifth, anyone with documented elevated inflammation, hsCRP above 3, that hasn't responded to aggressive lifestyle measures for at least 4 to 6 months. As with all GLP-1s, those with contraindications like thyroid cancer history, pancreatitis history, or pregnancy should not be using these medications. But here's a critical part. If you don't fall into one of these categories, That doesn't mean GLPs will never be right for you. Patients in these gray areas should have a thoughtful conversation with a knowledgeable healthcare provider who understands your individual situation and actively tracks your biomarkers. So here's what we know for certain and what we're still figuring out. The science on GLP1s for inflammation, heart protection, and brain health, that's solid. The 40% inflammation reduction, the 46% Alzheimer's risk reduction, the 20% cardiovascular protection, that's documented in thousands of patients across multiple studies. The science on microdosing, that's still being written. The mechanism does make sense. The evidence just isn't there yet. These medications are powerful tools, not magic bullets. They work best combined with good nutrition, exercise, sleep, and stress management. No medication overcomes the foundation of poor lifestyle habits. If you're interested in whether GLP-1 therapy might be right for your specific situation, not generic internet advice, but the kind of personalized medicine where we actually understand your health picture before recommending anything, that's exactly what we do at Bespoke Concierge MD. I'm Dr. Zaid Fadul. If this video was helpful, please subscribe to the channel. We're creating content weekly on longevity medicine, metabolic health, and the evidence-based strategies that actually work. Questions? Drop them in the comments. I read everything. What's your biggest concern about GLP-1s? What's holding you back? Let's discuss. Your question might help someone else watching. And if you're curious about whether GLP-1 therapy makes sense for your specific situation, again, let's just talk.